Science finally confirms what happens when we die. Ask your nurse friends about deathbed phenomena.
Now, if you go into a hospice, it's less so now, but very strong then. You find that it's divided into bands. There are the nurses who are in touch with the patients. They see all the phenomena of dying, and the doctors who aren't and say it doesn't occur. So there is really quite a significant difference between these two. And I have some really interesting stories about this gap between the medical and the nursing staff. As I say, it's less now. We did 3 hospices and a nursing home in this country, and we did 3 hospices in Rotterdam to get a cross-cultural component. It's not very cross-cultural, but it's just slightly different, a little bit further away. And we found the most fascinating things. And so it's allowed us to put together a measure of the sorts of things that you can expect. The first thing that you may get is a premonition. And that means that you know you're going to die. So before you get the diagnosis, you learn in a dream, maybe, or it suddenly comes to you that you're going to die. The Dalai Lama says all of us know 2 years before we're going to die that we're going to die. The next thing that happens is that a few weeks before you die, you get deathbed visitors. Now, what's a deathbed visitor? They are relatives who come to you, and they do it in a specific way. They may stand outside the room in which you're dying, or they may come into the room, and that's quite common. You, of course, will talk to them, and then a number of them will sit on the bed and talk to you. And we took 100 deathbed visions and analyzed them for content. And we found that the commonest people who come are first-degree relatives. Mother and father are commonly seen. Dead spouses are quite common. But we also, in fact, found that brothers and sisters come. We also found in our sample that spiritual beings were seen. Now, the spiritual beings behave slightly differently from the relatives. They tend to either wait outside the hospice, and they're seen through the window, or they may come to the door. The way that dying, I think, it's like this. Deathbed visitors come fine. Then, at some moment, you realize you're going to die, and it hits you hard. We're not coming back, guys. This isn't a getting well process. It's a dying process. And that then leaves you in a very difficult position because you've never come across that before. You've always had some control over something. You now don't. And so you have to start giving everything up until at the end you've lost your ego. You've lost that part of yourself which has differentiated you, and you become what's called non-dual. That means that you do, in fact, merge with the universe. You will become universal. So that's what the data shows. Now, before you die, I just want to add one other set of phenomena, and these are called terminal lucidity. Terminal lucidity is when the Victorians used to call it late awakening, essentially. And what it was is that you suddenly sit up in bed, say hi to the people around you. Actually, you don't say hi, you say goodbye, because you know you're dying, and then you lie back and die. Now, that's interesting enough, but it's much more interesting than that, because people who are paralyzed and haven't moved maybe for a year, been in a long-term care home, they can sit up and do it. So for those few moments, the central nervous system seems to work again appropriately. But more interesting than that to me is the people who have Alzheimer's disease and have in fact lost their memories many years back and just been in a care home will sit up, recognize their friends, say goodbye, sometimes meet their dead relatives and then lie back and die. So that's a real question for science, because how can you do these things if one just takes the argument that the brain secretes consciousness?